Why do some teens with scoliosis stand with their backs looking flat instead of curved when viewing from the side? And more importantly, why does this matter when we're looking at the whole picture of spinal health? Hi, I'm Mirenzi, and for many years, Scolicare has supported people of all ages living with scoliosis through assessment, evidence-informed bracing, and scoliosis-specific exercises. In this video, we're going to explore what a flat back means in teens with scoliosis, why it appears and how it can influence posture and balance, and why it's important to consider it in adolescents with scoliosis. So let's start here. The mid-back is supposed to have a gentle, natural curve when viewing from the side, but some teens appear flatter than expected, sometimes known as hypokyphosis. And when that is present, it is associated with scoliosis progression. The flatter their back, the more likely it is that the Cobb angle is large. From the front or back view, scoliosis shows up as a sideways curve in the spine. But sometimes there's something else happening, something that's a little harder to see at first, yet just as important. It's called a flat back. When we say a flat back, we're talking about a reduced curve in the middle of the spine when viewed from the side, the part that normally rounds outwards. In some teens with scoliosis, that curve is often noticeably straighter when viewed from the side, almost like someone pressed the natural arch of the spine flat. It might not sound dramatic, and sometimes it's subtle enough that parents and even clinicians don't notice it right away. But when this flattening is present, especially in a growing spine with scoliosis, it can influence posture and balance and is related to curve progression. So why does this flat back exist, and why does it matter for teens who are still growing? Let's zoom out for a moment. From the side, our spine isn't meant to be straight like a ruler. It's shaped more like a soft S from the side, and that mid-back curve, called kyphosis, plays an important role in posture and spinal balance. In some teens with scoliosis, the kyphosis can be quite shallow. It can also continue to flatten during scoliosis progression, and we can call that hypokyphosis. But what it really means is that the spine is losing its natural shape, and that can be related to progression. Research shows us that the more flat the patient, the larger the Cobb angle. This is why treatment must account for the 3D nature of scoliosis. You can't just push the spine back into place in that one plane. All corrective movements and bracing must have a 3D approach. Imagine trying to stack blocks on top of each other with a wobbly base. When that kyphosis disappears, the whole body has to compensate. Humans are stronger when there is a good pelvic position and the lumbar and thoracic and cervical curves are in place. Hypokyphosis isn't just about appearance or posture when it comes to adolescents with scoliosis. It can impact how the spine grows, and in a growing teen, that change can lead to a faster progression of the scoliosis curve. So, while it is quite typical for a teen with scoliosis to have a flat back presentation from the side, it is important to recognize it and consider the impact of this on the program. For example, when a brace is designed, the designer should be making sure that the flat back is not being made worse. The focus should be on the derotation of the posture and the spine, and in many cases, a brace that creates a 3D mirror image of that posture is essential. That's why recognizing and understanding hypokyphosis is so important. In a scoliosis-specific exercise program, the treating therapist should not try to correct the hypokyphosis in a 2D manner in scoliosis patients. Instead, they should be acting to try to detorsion the spine in a 3D way, which will help to make sure that the hypokyphosis is not made worse. With the right tools, you can often guide the spine back towards a more natural, balanced shape before things get too hard to manage. Before we go further, quick question. Have you or someone you know ever noticed this flat back looking at a teen with scoliosis from the side? Maybe the posture seems different from the side view. Tell us your experience in the comments below. All right, let's continue. Now that we've been talking about what hypokyphosis is, the question becomes, how do clinicians assess it? At Scolicare, there is a process we use when working with teens, whether it's their first appointment or part of their ongoing care. The first step is a detailed 3D spinal assessment. This goes way beyond just checking posture in the mirror. We use imaging, postural analysis to understand the spine from all directions, not just front to back, but also from side to side. This helps us identify hypokyphosis early and give us a clearer understanding of how the spine behaves during growth. Once we understand what's happening, we can create a personalized plan. Because when the spine is still developing, tailored support can help guide posture and alignment. One of the most powerful tools we may recommend is a custom-made 3D brace called the Scoliosis. These braces are individually designed using digital scanning with the aim of supporting the scoliosis curve and encouraging it to be in a more natural side view position. This is different from a generic brace. A custom 3D Scoli brace is specifically designed for the person's body and curve pattern. But bracing is only one part of the picture. We also pair it with our Scoli Balance program. It is a specific scoliosis exercise program. They aren't just general stretches or posture drills. They're carefully targeted movements and train the muscles and neuromuscular system to support the spine's new position, not the scoliosis position. Together, these pieces, the assessment, bracing when appropriate, and a scoliosis-specific exercise plan will address the person's needs. And the earlier we start, the better the outcomes. So let's bring this all together. A flat back in teens with scoliosis is more than just a minor posture detail. It's a clue to how the spine is behaving in scoliosis. By identifying it early, clinicians can provide guidance and discuss options that may support a more balanced alignment as the teen grows. That's when we see real change. At Scolicare, we don't just treat curves, we treat the human being with the curve. Each plan is individual according to the patient's spine, goals, and their future plans. So if you're a parent or a teen or even a clinician trying to understand this better, you're in the right place. If this has helped clarify things for you, there are more resources on our channel. And from all of us here at Scolicare, thank you for watching.